Hi, my name is Eric and I'm a real Lasik patient. I just wanted to make this quick video because I was a little confused with the Lasik procedure as I was going through it. And afterwards, everything is a lot more clear, not only in my vision, but just the whole procedure. And what you're going to need to know is that there's typically two big appointments you're going to have. Following up to your actual operation, you're going to have a pre-op appointment. At this appointment, what they'll do is they'll test your eyes for various things as far as dryness, the thickness of your corneas, seeing if you have any corneal diseases. What they do at this pre-op appointment is they're actually determining if you're a LASIK candidate and what might be the best procedure for you based on your eyes. Typically, this appointment runs anywhere from like $150 to $250 depending on where you go. But most places, what they'll do is say your actual procedure for two eyes would be $4,000. If it's a $200 pre-op, then your procedure will only cost you $3,800. So they'll subtract that money out of the actual procedure. What they'll do next is, after they figure out if you are a LASIK candidate, then they'll follow up and set up an actual date for you to come in for your surgery. Surgery actually doesn't take that long. You're looking at about a half hour to an hour total. For me, I was probably out of there in 15, 20 minutes once at the actual surgery. And the week leading up to it, if you do wear contacts, you're not going to want to wear contacts for that week. So you want to have a game plan in place for that. And then for the actual surgery, you are awake and obviously your eyes are open for it. What they do is they're going to numb your eyes, and then if you get the bladeless option, what they're going to do is they're going to turn the flap back and they actually have lasers that come in and fix your eyes. And for me, the most uncomfortable part, which wasn't really that bad, was actually the lasers, because you do have a slight smell that they suck up real quick with a fan. I can tell you that the first eye, I was very tense. I was holding a stress ball. My legs were sweating. I was so tense. But when they did the second eye, I was tossing the stress ball up in the air, talking with the doc, just chit-chatting with them, because the not knowing is what was stressful. And once I knew it the first eye was like, the second eye, it was fine. There's no problem. After your surgery, they are going to follow up typically about a week later and then a month later. You want to talk with your doctor to see what their follow-ups are and make sure that that pricing is included, that your follow-ups are included with your surgery costs. One thing you should know too is that if you're middle-aged and you're thinking about LASIK as an option because you use readers and you don't want to use readers anymore, LASIK actually doesn't change that. LASIK is for people with astigmatism and nearsightedness. So just calling the number that's associated with this, they can actually explain more of these details to you. But you'll want to talk to a professional and figure out if LASIK is an option for you. So give the number a call, talk with a professional on the phone. They can schedule a pre-op appointment for you. Then from there you can figure out if you are a LASIK candidate and kind of figure out what your options are. As far as I'm concerned, I love it. I like golfing in the summers. I can see drives now land far out. When I'm driving at night, I can see street signs, and it's so much easier and more convenient not having to worry. I never liked contacts. I always wore glasses, but sometimes I forget them and stuff like that. So every day I wake up, I have better vision than I did 2 years ago, and that feeling is really awesome. So I do think that it will be one of the best investments you ever make. And if you do have any more questions, call the number. And really hope that things go well for you and that you choose to get LASIK, because it's a great investment. All right, take care. Bye.